So we lost Simmons, and I've been asked to give a tribute to him. This will be one of many, and given in many different ways over a period of time. But this is Simmons with his older sister as a very young boy. Grew up in Brooklyn and on this corner, and lived in a walk-up apartment with his parents and his sister. His dad was a dentist, and they were adjacent to his dad's practice. It was in many respects at that time a very traditional family. So his dad was the dentist, his mom a stay-at-home mom, but one who had very significant influence on the family, including Simmons. So, there we go. Cute pictures, right? So here he is, beginning to find his way, and you can trace Simmons here, now with his mom, his father, and his sister. And John Lowenstein was saying this earlier, but we all are reverberating with these jokes and comments that Simmons would always make. And he would always say that the purpose of having a tie was just to protect your shirt against getting food on it when you ate. And I look at this picture and realize this is probably where he learned that, So. As he began to mature, you can clearly see a resemblance. And when I was putting this talk together, I thought a lot about the life, the world that Simmons entered when he was born in 1933. And it was a very tumultuous time, not only in the United States, but in the world. Of course, we had just entered the Great Depression. So life was very, very difficult. The Lessells did not have a lot of money. His dad was professional and working well, so they did better than most. But he grew up in what you'd probably consider to be a lower middle class environment that was multicultural, filled with Italians, in fact. Simmons and I, we often kidded one another. I said, Simmons, if I was going to be anything else, I'd be Jewish. And he said, if I was going to be anything else, I'd be Italian. So, so we shared this kind of experience culturally that we enjoyed. But economically in the United States, it was very, very difficult at that time. And of course, tuberculosis was raging in this country and elsewhere. And so the medical imperative of trying to wrestle with disease that could have devastating epidemiological consequences was clearly on his mind, as well as a lot of other people's. And then the scourge, huh? So you think about what that must have been like and how it must have affected him. Simmons had many, many interests in life. One of them was military history, and I think it's easy to appreciate the impact and what it must have felt like to grow up as a young Jewish boy in a family with the consequences that were going on in Europe. And of course, the success in winning the war, the exhilaration of that, and here at that time, this is in New York, not far away from where Simmons grew up. It was an extremely exhilarating time, and gave many ideas, I think. Here, the opportunity to express oneself was there, and Simmons didn't always follow the rules, however, because prohibition was also in place at that time, and this is something that Simmons never followed. And I think many of the trainees, including Joan Miller, remember fondly that Simmons always had a stash of very good alcohol in the office. And when the doors would close at the end of the day, it wasn't uncommon to pour a very nice single malt scotch or other beverage and just sit around and talk. Simmons also very much loved sports. He grew up in New York, and it's not a surprise that he was initially a fan of the Yankees, however. This is in the year that he was born, when the Yankees committed 7 errors but still beat Boston. So Simmons eventually became a big Red Sox fan, and but his life, the way he chiseled his life forward professionally, really began at this point. This is a picture from the year that Simmons entered his high school in New York City. This is what that environment looked like. And of course, I'm referring to the famed Stuyvesant High School. And it was a grand building, a really extraordinary high school. And Simmons was always very proud of this, and as many of you know, this is another similarity that we had. He would meet people and ask them where they went to high school. And that was one of the first questions. And this is very typical in New Orleans, where I'm from, too. And the point is that it often says a lot about someone, the environment within which they grew up and such like this. And so Simmons finally remembers and recalls the high school that many of our trainees went to. And then his two beloved training institutions were Stuyvesant and then Amherst. And so here's a picture of Simmons at the time of his graduation. And he was class president. I've tried to talk to him about this many times, and he didn't want to say much about it because it had other things in here that I think he didn't want to admit to. You had the basketball team, the baseball team. I said, really, Simmons? And he would just say, well, I never played professionally. While he was at Amherst, he met Irma Miller. And this completely changed his life. And on this day, they married. Simmons wore a watch from this point forward, the back of which was engraved with this date. Same watch, his whole life after meeting Irma. And that was a testament, really, to the kind of relationship they had here on their wedding day. They lived, in many respects, a wonderful life. They had serious hardships as well, but they always remained a duo. They had 4 children, lost one, tragically, and these are the 3 surviving boys. On your right, Newell Miller, that's Irma's maiden name, and Ephraim. We'll come back to that name in just a bit. So professionally, after training at Amherst, Simmons then went to medical school at Cornell, and there met Edward Norton, who trained here in neuro-ophthalmology. And this is where Simmons first really began to think about vision, and in particular about neuro-ophthalmology. So Ed Norton really helped guide Simmons' early formative years about what kind of career he wanted. And then Simmons went to the University of Vermont to do a neurology residency. Seated here in the front is one of 2 of Simmons' great mentors. This is George Schumacher. Really, he was an amazing force in the field of neurology and just an amazing influence on Simmons' life. Many of the traits that we know of from Simmons, this sort of punctiliousness, the way he had this vigor of approaching a diagnostic case with patients, that attention to patients one-on-one. A lot of this were traits that George Schumacher had. They were within Simmons, and I think they just really grew because of this experience. This was at a birthday party for George that Simmons was very proud to have attended. And then after that, Simmons came to the Howell Laboratory here, Mass Eye and Ear. You can see the wonderful old building. And here he met his second great mentor, and that was David Kogan. And of course, David Kogan was really one of the early founders of neuro-ophthalmology in the United States. So it was Frank Walsh, Bill Hoyt, David Kogan. David Kogan was here, and as was typical at the Howell Laboratory in particular, they spent a lot of time thinking, strategic planning, what kinds of things they should talk about. They met regularly, they talked a lot, they exchanged information. So here you see Simmons at one of those discussions. But David Kogan was a great researcher, many disorders named Kogan syndromes, but he was also a clinician. He was the first neuro-ophthalmologist here. He founded the service. But at that time, there wasn't even a name neuro-ophthalmology service. This was something in evolution, the idea that you would merge neurology and ophthalmology as a unique subspecialty. But David Kogan led that. And then Simmons became a resident here at the infirmary. This is a pretty heady class. I mean, here's Simmons here. Recognize him? Bob Peterson, right? George Garcia, whom you'll be hearing from next. Steve Fricker, Howard Leibowitz, here. Many others. It was a pretty remarkable class, actually. They look, I don't know, a little stiff, right? I think you have to say. But it wasn't always that way. Here they are celebrating a little bit. That's Howard Leibowitz over to your right and Simmons in the middle. And but this training at the infirmary clearly established Simmons' path in his career. It gave him a foundation both scientifically and in clinical medicine. And his first job as a faculty member was at Boston University. So this is Ephraim Friedman. Remember, his youngest son was named Ephraim? This is Ephraim Friedman. And Ephraim trained here as well and then became chairman of ophthalmology at Boston University and recruited Simmons. And Simmons spent a bit under 20 years there and was just an instrumental force in the Boston University program. The Boston University program had always been, still is, relatively small, but it provides very, very good training because it had a small number of very good faculty. And Simmons, for all the years he was there, clearly was the leader. And they had a very, very close relationship throughout their lives. Ephraim Friedman then left to become dean at Einstein and ultimately came back to the infirmary as the president here when I was just starting on faculty. But the infirmary grew partly because of Ephraim's involvement administratively. And this is where Simmons returned in 1984. And here's one of his notes. I can't tell you how many hours I would spend reading these notes, right? They were handwritten notes. He would sit there and write every word. And he would do this repeatedly on his patients. So instead of just saying normal, he would highlight, no cells in the vitreous, all these fine details, intelligent, cooperative, healthy-looking woman, right? Their occupation, right-handed, left-handed. He wanted to know if they were one of twins. He had this litany of questions that he would both ask and record, right? So this was one of his many traits, that if you were going to be with patients, it required a dedication of time to listen to what they had to say and to record that information. But once again, as it was a theme in Simmons' life, it wasn't always hard work. So this is at Alfredo Sadun's house. Now this is when I was a first-year ophthalmology resident at BU. Alfredo was one of Simmons' two fellows then, and he was leaving for his first faculty position, had a party at his house. Simmons, as you all know, had a remarkably great sense of humor. And Johnny Carson in those years was loved by many, and he did a Karnak routine. And so Alfredo made this hat for him, and Simmons would often put it on, and they would do jokes back and forth together. So I was very fortunate in my life professionally changed dramatically when in 1985, I became Simmons' first fellow at the infirmary. And it began many wonderful years together. So I worked with Simmons at Boston University for 3 years. So we began to work together in 1982. And then I came here and was his only professional associate for many, many, many years. He was fond of saying that our relationship lasted longer than most marriages, and we would celebrate. So for our 25th, we went out to the Four Seasons. We did. It's pictures of him in the office with Irma and my wife Sarah, and we really celebrated. Excuse me. So he also used to refer to us as the odd couple because though we were together and stayed together and really, I think, greatly valued one another, we did things in a very, very different way, and it worked. We were connected in another way as well. So this is Franklin Park in Brooklyn, and this is where Simmons grew up. At the same time, a short walk away, my mom grew up. They did not know each other then, but surely I knew a lot about the world that Simmons grew up in because of the stories from my mom. When Simmons came to the infirmary, he got more of his swagger. So here he was, still with the Karnak hat, sort of dancing around his office. And, Simmons was never shy, right? He fancied himself as the goalie in hockey. He was often talking about his prowess. Someone challenged him one day, and he said, yes, I have chest hair, though he had trouble finding one when asked to show it. This is Bob Guy, he's the pediatric ophthalmologist in Worcester. And, well, Simmons just leaves us with so many stories, but we can all just remember that laugh, right? And it was always there. In fact, it was usually there laughing at his own jokes before anyone else did. But he was really just such an extraordinarily spirited human being. He loved his family. He loved what he did professionally. And he lived large in a lot of ways. He was a real force, and he loved being around people and trainees. Here at one of our fellowship gatherings at one of the NANOS, the neuro-ophthalmology meetings, where we would all get together, and at the end, Simmons would always say something and be toasting people. And he was just a remarkable force in the field of neuro-ophthalmology, but also with his fellows individually. So Frank Walsh, Bill Hoyt, and David Kogan really established neuro-ophthalmology in the United States. But I think only two people popularized it. And that was Simmons Lessell and J. Lawton Smith. And he just had an enormous influence in expanding the field and encouraging people like me and many others to choose this as a profession. Simmons in his later years tamed a bit, and there was a relaxed side of him that I had never really seen in the early years. And here he is in my backyard at my home for one of our end-of-year parties with the fellows. And he just had this relaxed sense, very warm, really wanted to spend time with the residents and fellows. We shared a lot together. And by the way, there's that watch. That's the watch he wore for all those years, inscribed with the date that he met Irma. One of the great moments, as he told me, was the tribute that we gave to him, this Festschrift, which we gave here on his 80th birthday, with all of his fellows returning, some from overseas, and each of the fellows gave a talk, and the talk was basically geared about how Simmons influenced their lives, not only professionally, but personally. These were remarkable stories. Really, a lot of tears were shed about the influence that Simmons had. Well, Mark Borchert, for instance, one of the fellows, his son working here now with Cheney Wiggs, is named Simmons, right? And Mark at this podium told us a depth of story that I didn't know. Mark is here in the back, about how he really didn't know his father and how Simmons really became his father. They remained very close. They were great fishing buddies. But this was a grand moment for all of us at Simmons Festschrift. And again, he was just in his glory at that event. So I did with Simmons a Karnak monologue. So I fed him questions, and he had the envelopes, and it was just a riot. We have the video of it if you're interested. So in many respects, it was sort of, I will say maybe a culmination, but it was clearly a high point in his life to look back and have everyone in one place and just reflecting on the role that he played. But in the end, as great as Simmons was professionally, there is no question that his life was centered on and grounded by his relationship with Irma. So this is a picture that I took of them, and I took several pictures of them that they both loved. And they kept this proudly displayed in their home. You can see Irma's drinking a martini. And the other close contact that we had, the connection that we had, is that my mother introduced me to martinis. And my mother and Irma were very close. And when they would get together, they would sit and drink martinis. So it was very, very special. Well, Simmons, we will miss you. So how do you give a tribute to someone like this, right? How do you do it? So Joan and Janet, we've been meeting regularly to think about this. There's a long list of things we're going to do. Small tributes, big tributes, this tribute. You know, you always feel like you never quite get it. You know, doesn't matter how many times, how many ways. And obviously, in the end, the tribute is, in many respects, kind of personal, individual. Each person who is influenced by Simmons knows what that means. The best way we're going to try to do it is to establish what will be the first in the world Simmons Lessell Endowed Fellowship in Neuro-Ophthalmology. You'll hear more about this from Joan. But our goal is to sustain the legacy, both to enrich the field of neuro-ophthalmology, but to do so in the way that Simmons would have wanted it to be done, which is the sort of one-on-one teaching with fellows and residents, with patients. And this will help us in that mission. Joan has also established a teaching award that will be given in Simmons' name every year. So larger than life, it'll be a memory that we all have. And thank you.